we're in a mad scramble to develop effective drugs and treatments for COVID-19. When impactful articles come out, research teams react in certain ways. They adjust their research questions, move those questions further along, backtrack and go in a different direction. And these sorts of experiences where journals have to retract articles can have a ripple effect in which they impact other areas and other research groups as well. So we want to try to avoid that at all costs. Now, we have safeguards in place. We have institutional mechanisms to help ensure that research gets done properly and the quality product comes out the other end. But ultimately, it's the researchers themselves who have to reset their moral compass at a time like this and say, you know what, I'm not going to give in to the pressures acting out on me right now. And I'm going to do my science with the same steady but effective and robust mentality that I've always done my research with. And that's really what's needed at a time like this. So I would say that this is one of the really key challenges facing researchers right now, is the pressures acting out on them and how they respond to them, and how the institutional enterprise, the research enterprise as a whole responds as well. How peer review systems respond, how journal editors respond, how institutional review boards respond. But we haven't talked about that, but institutional review boards are seeing a big uptick in the number of research protocols that are focused on the coronavirus, COVID-19, various public health elements of COVID-19. A lot more protocols are coming onto the tables of IRBs across the country and across the world. And we've already have some evidence to suggest that there's also been an uptick in the number of questionable protocols that IRBs have to look at. Questionable in the sense that designs have been thrown together too quickly. Methodologies are proposed that may be harmful or that may undermine the safety of research subjects. Informed consent processes are an afterthought in some of these protocols, where researchers have clearly felt informed consent is either not necessary or not required to the degree that is really informing subjects. And I think the underlying feeling here is that we're in such a crisis state that we have to sacrifice some of our usual ethical benchmarks and standards in the effort to speed up the research on COVID-19 and to get it done as quickly as possible so that we can move forward with developing treatments. I think there is an underlying sense that we are in fact justified to lower standards to some degree. And we see that also not just in the quality of some of the protocols submitted to IRBs, but also in the discussions that are now taking place around the country and around the world with respect to the kinds of trials that are considered acceptable. We have human challenge trials, for example, and these are trials that probably would not be allowed in normal times. These are trials that are involve healthy human volunteers for vaccines and treatments that we don't know that whether they have any kind of effective efficacy. In normal times, we would say there's no way you can inject a healthy volunteer with some sort of medication, knowing it might give them a disease or a condition that could kill them. Sure, maybe it's only a 5 or 10% chance of mortality in that situation, but ethically speaking, we wouldn't permit that kind of research. But today, we're not only having those conversations; those trials are moving forward. Similarly, we're moving trials into the human research space that haven't really been tested fully on animals. And that raises ethical questions about whether one can leapfrog some of the steps that we've put in place for other types of research, and that we conform to in normal times.